Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Is French fries potato consumption related to adverse health outcomes? Epidemiological observations suggest increased potato consumption does correlate with adiposity and diabetes risk along with weight gain as well. While nut consumption is often associated with weight control and metabolic health, however, a recent randomized controlled trial data suggested no causal relationship between an increased French fries potato consumption as well as the negative health outcomes. The study findings were published in the American Journal of Clinical Nutrition. Hence, folks, fries all the way. SGLT2 inhibitor dapagliflozin may prevent cardiovascular complications in type 1 diabetes patients. To date, DAPA is the only approved selective SGLT2 inhibitors in adults with type 1 diabetes mellitus. And as we've previously read, the DAPA-HF trial that was published in the American College of Cardiology does say that dapagliflozin is found to be superior to placebo at preventing cardiovascular deaths and heart failure events among patients with heart failure. However, the recent study, the data published in PLOS One, supports the preventive and protective role of SGLT2 inhibitors in cardiovascular disease associated, rather tied, with type 1 diabetes. The SGLT2 inhibitors are considered a novel class of anti-diabetic drugs used mainly in type 2 diabetes mellitus patients. Children with insomnia likely to continue to suffer as adults long term. According to a new research, insomnia is a serious disorder and children with insomnia symptoms are likely to persist with them as they grow older and as they mature to young adults and are significantly more likely to develop an insomnia disorder in early adulthood when compared to children who do not have any difficulty while sleeping. The study describes that the developmental trajectories of childhood insomnia symptoms through their adolescence and into their young adulthood. Sleep disorders, especially sleep apnea and insomnia, are linked with poorer cardiovascular and mental health. Hence, sleep is essential. Men with hypersexual disorders may have elevated levels of the love hormone. Hypersexual disorder is considered a non-paraphilic sexual desire disorder that involves excessive and persistent sexual behaviors in relation to various mood states with an impulsivity component and even experienced loss of control. Men with hypersexual disorder may have higher levels of oxytocin in their blood than men without the disorder, as per a new study that has been published in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism. Fear a factor for avoiding sexual intercourse in early pregnancy. A recent study in International Society for Sexual Medicine reported 28.8% pregnant women had no sexual intercourse for 4 weeks. All types of fear were considered important among pregnant women, and the more important fears were infection and injury to the fetus. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.